I met with Dr. Masrobian regarding fatigue issues and so forth, and she noticed that there was a definite problem in the sound of my heart. So she referred me to Dr. Wallace, and I met with him soon after, and he did some various tests and concluded that I had a severe aortic valve something. I forget the other word, but whatever it wasn't good. So they had hoped that I could have a TAVR type procedure, which would avoid the traditional open heart surgery.
TAVR addresses disorders of the aortic valve, and so it is designed to take care of or replace an aortic valve that is stenotic or not opening as well as it should. I explain it as a minimally invasive way to replace the aortic valve. Instead of the traditional way of a surgical replacement of the valve, where we have to open the chest, go on the heart-lung bypass machine, and then surgically resect the old valve and replace it with a new valve, we're able to go in a minimally invasive manner, typically through one of the large arteries in the leg, and then thread the new valve up until it is inserted inside the old valve.
So the day of the surgery, I woke up in the recovery room and not in the ICU, which was a really good thing. And that day, actually, it was so funny because I tell my wife, all I got left is my hair, baby. So I got plenty of hair, but through all that, through the surgery and everything, in the hospital room, in the bed, I had my picture taken, my thumbs up, just hours after the surgery, and wrote a Facebook post. And my friends teased me because they asked me, who fixed my hair for that? I said, no, my hair looks just the same as it did.
For the group of patients that we do this procedure on, it has been found to be equivalent to the older surgical techniques. However, the benefit is that the length of hospitalization is much shorter. Our typical patient spends one night in the hospital. The amount of recovery time following is also typically a minimal amount of time. Again, for most of our patients, after that one night in the hospital, they take it easy for about a week, and then at that point really can get back to doing all the things that they were previously doing and more.
After the procedure, that next day I stayed over one night. I went home. I was asked within a few weeks or a couple weeks to be able to walk 30 minutes a day. And instead, the second day home, the day after I got home, I walked 2 hours. And I was just sort of the miracle recovery. I mean, the amazing technology. And to think that just a few years ago would have been open heart surgery, and I'd probably still be dealing with, follow up on that, because that's a lot more invasive, obviously.
It's a relatively new procedure, but people ask kind of how long it's been going on. The technology's been in existence for almost 20 years now, and we've been doing it here at this institution for almost 8 years. The number of patients that are qualified for it has been expanding over really the last few years, and so I think it's becoming more and more as an accepted practice for the treatment of aortic valve disease.
So the three ladies I worked with were Latricia, Dina, and Angel. And that's an appropriate name because they were all angels. They were fantastic. And it was, you're going into a world of unknown. And for them, they deal with it every day, but they didn't treat me like they were dealing with it every day. They understood my questions, my concerns, and they couldn't have been better So what would I say to another person? I would say, first of all, everybody's different, but follow your doctor's advice, and if they suggest this is an alternative and the way to go, believe me, it can be totally fantastic, and hopefully it would be for them as it has been in my case.